You are a true hero of mine. So this is like,
Oh my gosh, thank you so. Wow, that means so much to me.
um, I know that we only have an hour and I have so much I want to dive
I
into.
know. I
So
saw you. I was like, oh my gosh. Like,
it's
I mean, just
coming.
I
I've
mean, like that
organized.
topic alone could be an hour or two.
I know I've organized as best as I could to really, and if it's all right with you, can we hit the ground running?
Let's do it. That's yeah. I hopped on. I was like, let's make sure we're on time.
Thank you. Um, so I have three things that I want to lead with because I think it'll really inform a lot of the other things that we're speaking about. And they're just three things that I feel like we have to hear from you on. And the first one, and I'll just jump right into it, is fever phobia.
Yes.
And and so, I always, and you can tell us about the benefits of a fever and how a fever is intelligent and what it's actually doing in our children's bodies and in our own bodies. And then we can kind of go from there. But I always feel like having respect for the fever is a great place to start.
Yeah. Well, we do know that fever, from an evolutionary standpoint, is our natural response to infection, to a stressor, even psychological stress can trigger a fever. There is an underlying, chemical cytokine pathway that's triggered. And when we have an infection, a fever actually does several things. So it's a sign that our body is mounting that immune response, right? It's saying, all right, army, let's go get these bugs and get them out of here. So it's helping us fight that infection. The fever itself, the temperature rising, is fascinating because that too slows down the germs literally, and that makes it easier for our immune system to target those infections. And what we've got, we all think, well, why is it in the wintertime that we get more of these colds, flus, viruses, respiratory things going around? Is it just because we're huddled inside, and just more exposed to each other? Well, there actually is something about the cold. When it's cold and our nasal passages get cold, the germs actually have an easier time taking hold as well. So the fever, when we are sick with the fever, it can make it even harder for those infections to flourish and much easier for our body to fight the infection. And in fact, and we can dive into, fever reducers like Tylenol and ibuprofen, which right now there's a shortage anyway. So I have a lot of parents panicking. What do I do? My kid has a fever. But there are several studies, and these studies are way back from even like the 1970s, showing that when we artificially bring a fever down with, let's say, Tylenol, with acetaminophen or ibuprofen, which is Advil or Motrin, it might help your kid feel better temporarily, but it actually might keep your kids sicker for longer. We can see that with influenza virus. We can see that with chickenpox, which not a lot of kids get anymore. But Tylenol was shown to increase the duration of that vesicle, right, that blister that you get from chickenpox, and prolong the time to scabbing, which when kids scab over, that's a sign that they're healed up. One study even showed that using Tylenol could increase viral shedding from your nose. And aspirin, NSAIDs, ibuprofen type medications can increase the shedding from your nose and increase symptoms, nasal symptoms. So there's a lot of reasons why we might want to think carefully about when and why we're giving a medicine like Tylenol and ibuprofen. And I would never say never, right? There's always a time and a place for most things. But we also know that there are times where we want to be a little more judicious.
Yeah. And I've heard that having a fever, and so I'm thinking of it, more in the adult way, more for myself than children, but does a fever help to cleanse the body of cancer cells?
I haven't heard that, but we know that, that is also a response to cancer as well. And so, anytime we think, why is our body doing this? Why did we develop these pathways, which really are from, I mean, the primitive pathways, our body's response to physical, psychological, infectious trauma of any sort is the same pathway. You know, we go through that same cascade of inflammation. And so even when we fight a cell that shouldn't belong in our body, like a cancer cell, that fever is part of that natural response. So that would be something really interesting to look at, because there has been a call for looking at when we reduce fevers, what is this doing to our global, you know, public health in terms of this flu epidemic. We've had flu pandemic, certainly with COVID-19. We're still, you know, in the midst of this pandemic, not in the same emergency state that we were back in the beginning of 2020. But I'm going to pull up this article from 2014, which showed that fever suppression can increase on a US and a global level the expected number of influenza cases and deaths in the United States just from suppressing the fever alone. Right. And in 2010, researchers tried to find human studies on whether or not fever reducers or antipyretics were actually harmful in the case of influenza, because some of the animal studies showed that it could increase mortality. And so the authors noted in 2010 that we need randomized placebo-controlled trials of antipyretic use in human influenza infections. They're urgently required, and that these are sufficiently powered to investigate the potential effects on mortality. Now, if you're a parent listening right now, and if you're, you know, or you're an adult who has the flu and you've given your kid, you know, ibuprofen or Tylenol, it's okay, right? We're just talking about on a global level. Don't worry about that, right? We do the best we can as parents, but at the same time, now, given that we know that fever can be beneficial, you know, for fighting the fever, right? And B, that reducing the fever might actually make it harder to fight the infection and be worse for your child and for yourself. Let's think about what else can we do? First of all, as you said, we open up with the fever-phobia. We have to take away the phobia and the fear, right? We have to understand that this is our body's natural response. We have to accept that. We have to accept the discomfort that can go along with fever, and then know what else can we do from a more natural standpoint that doesn't suppress the fever, but helps our body when it has a fever to overcome it a little bit more quickly, to overcome the infection a little more quickly as well.
And so you know, I think that there is the phobia part is that when a parent sees their child has a fever and they go, oh my God, it's 103. And there's this thought that like there could be brain damage, or it's beyond my child suffering and I want to help them be comfortable. It really goes into a fear state of the fever is doing some kind of, I feel like brain damage is the one that I've heard. So can you tell, when does that kick in?
So
just to kind of perspective.
Yeah, I mean, you know, I'm so glad you're asking this, because that is actually the number one question I get. Well, you know, shouldn't I treat a fever because of these more serious things, like, and I get, you know, brain damage or seizures or, you know, meningitis, right? Won't treating the fever prevent those? Okay. Well, let's first take the brain damage concern. In a neurologically normal, intact brain, we have these thermostats, these internal regulators that keep our fever from getting, quote, too high, you know, to really do brain damage, right? You have to get to, you know, over 107, 110 degrees, right? 107, 110. I mean, you cannot get to that height of a fever unless, you know, you're so bundled up that you can't sweat and release the heat, right? Or if there's external factors, right? You're in a really hot room and unable to let go of some of the heat through sweat and through, you know, exhaling and breathing out some of that heat through your breath as well, right? So that's why we don't necessarily want to bundle our kids super tight and warm when they have a fever. We want them comfortable, but we don't need to overwrap them, okay? So getting to, and kids routinely, the younger you are, the higher the fever tends to get, right? We see young kids with 103, 104. I've had kids even with, 105 fevers in my office. And here's the thing, you want to look at your child, not the number on the temperature, on the thermometer. Okay? I have kids, and my daughter is one of them. When she gets sick with the fever, she goes to 104, 105 fairly commonly. And I've learned not to, that first time you see that temperature, like, oh my gosh, she's 104.5. Even me as a pediatrician, right? I'm like, whoa, that's hot. But she'll be looking at me, her face is bright red, but she's chatting away and she still wants to drink and has a little bit of an appetite. And then I'll take her temperature and I'm always like, wow, you're hot, right? As opposed to my son, when he gets a fever, when he's sick, he doesn't go that hot. He'll get to maybe 100.8, 101, 100.3, but he's laying on the couch like, he's just miserable, moaning, doesn't want to move, and can barely drink. So I'm more concerned about him in that state, right? Because he has more symptoms of being more ill than my daughter. And I don't necessarily treat those fevers any differently, right? Mm-hmm. So look at your child. Don't look at the thermometer necessarily. Now, that being said, if your kid is over 103, 104, I still want to know as a pediatrician, right? I still want to know, hey, Dr. Song, my kid has a fever. What should I do? What should I look out for, right? But then the next question, can reducing fevers prevent seizures, febrile seizures? Now, febrile seizures are so frightening if you've ever had a kid who's had a fever and then they have a seizure. Now, they're not very common, thankfully, right? But if you're the parent whose kid gets seizures when they have a fever, that doesn't help to know that's not that common. Fortunately, we know that it's really the younger age group, 6 months to about 6 years of age. Once kids are older, they outgrow it, and it doesn't cause any permanent brain damage or problems. Okay, if your child has those kind of classic febrile seizures where they get a fever and then they might have a generalized seizure for a brief period of time, they wake up and they're totally fine. Right. The studies are really conflicting. And I've had some parents say, well, I was told by my pediatrician to just start fever, Tylenol, Motrin around the clock, alternate every 4 hours, as soon as my kid gets a fever, so they don't get a seizure. That's actually not ever been really proven to benefit and help. If your child gets febrile seizures, it's usually because of how quickly that fever goes up. By the time you get Tylenol into your kid, when they have a fever, it's probably not going to help them in that moment. Right. And if your child has never had seizures when they have a fever, there's no reason to think that they will get seizures with the next fever, and that giving Tylenol or Motrin will be helpful. Right. So we want to use kind of our integrative toolkit whenever we can. And fever itself does not cause meningitis. That was a question I actually just got this morning. There's no way fever alone can do that. Meningitis is caused by bacteria or viruses. It's the infection that causes meningitis, which thankfully, again, is very rare, but just having a fever is not going to tip your kids over to all of a sudden having an inflammation in your brain.
Okay, that is very helpful. Thank you. And now we have to cover antibiotics.
Yep.
And so I think we'll start with, when are antibiotics actually appropriate versus how are all the ways that they are prescribed or requested that would never be helpful? I've heard you talk about earaches and that they're not helpful for earaches. And I feel like that's a big one. I feel like my entire life was derailed as a young child being prescribed antibiotics for a chronic earache, and that antibiotics don't work on a virus. So will you just educate us so that we can think about it at home before we make any requests?
Yeah, this is really one of my passion topics. It is such an important topic for parents of kids of all ages to understand for many, many different reasons. From just a global public health reason, there's so much antibiotic resistance now because of the overuse of antibiotics that now even some very common, easy to treat bacteria are no longer susceptible to the antibiotics we have at hand. Like, for instance, E. coli, which is a very common source for UTIs in women. I mean, could you imagine if we lost the ability to treat a UTI, a simple UTI that then could progress into a more life-threatening infection? And by 2050, some estimates are showing that antibiotic resistance could become one of the leading causes of death in the world. So that alone should make us stop and take pause and say, whoa, let's think about how we're using antibiotics and make sure that we're only ever using antibiotics appropriately. And of course, we would hope that when we're prescribing an antibiotic, it's always done appropriately. Unfortunately, let's look at some of the numbers. Okay, there's I want to say, and I might have these numbers wrong, but I want to say there's about 500 million antibiotic prescriptions written in the U.S. Okay, over half of those are for children, over half. Okay, and in some studies, about 75% of those antibiotics written for children are inappropriately prescribed. Okay, and this is often, it's often no fault of your pediatrician or your fault, right? We're just doing what we think is best. But then in retrospect, we look and we realize, okay, many of those antibiotic prescriptions are not appropriate. And some studies even show that by 2 years of age in the US, about 70% of all kids have had at least one antibiotic course, right? And my kids are in those numbers, right? I don't say never antibiotics. My daughter had a UTI when she was about 2 weeks old as a baby, right? And of course I gave her the antibiotics. My son had strep in his ear. We all had strep there in the family, and he had strep in his ear with a perforated eardrum at 5 weeks of age. And yes, I gave him the antibiotics, right? We're going to talk about, the problem with antibiotics in infancy, though, and what you can do. But antibiotics, what don't they work for? As you said, they don't work for viruses, period, right? They don't work for yeast. They don't work for parasites, except for maybe some of them. Almost all of the infections that your kid will get in their childhood years are viral. Okay, the vast majority. So wanting to start an antibiotic, I get when your kids are sick, you're like, what else can I do? Right? That's why I use, all of my kind of alternative holistic remedies in addition to antibiotics when necessary, because we feel the most fear and anxiety when we feel helpless, when we don't have something to do, right? But antibiotics aren't going to help that. Another way the antibiotics may be prescribed inappropriately is when too strong or too broad an antibiotic is used for a very simple indication, like using maybe azithromycin for an ear infection when you might want to use amoxicillin or a penicillin family, which is much broader in the bugs that it will kill. Okay, and so that's the other thing too. Once we know that, what's really interesting, there's one study looking at physicians. They are more likely to write a prescription for you if they think you want one, even if in the back of their mind they're thinking, I don't know, this is probably viral and I don't know if it's going to help, right? So when you go and your doctor gives you a prescription, you can always ask them, do you really think this is necessary? That's not, a judgment. It's just asking, hey, is this really necessary? What would happen if I just waited a little bit? What if I decided to try some other things first, and have a frank conversation with them. And the reason why, apart from the antibiotic resistance, that I worry, as a pediatrician about antibiotic use in kids, and really educating parents on when they use antibiotics for their kids or for themselves, understand how to mop up some of that downstream damage, is because antibiotics are the single biggest one-time disruptor to your child and your gut microbiome. And the gut is everything when it comes to especially children's health, especially babies' health, because we know that the development of a healthy gut microbiome from the moment your child is born, like even inside your womb, right, from the moment that they're around, to about 3 years of age, maybe 5 years of age is a critical time for your gut microbiome and all those good bugs, those probiotics in your gut to train and educate and inform the development of their developing immune system and their developing brain. Like 70% of our immune system is in our gut. 80 to 90% of the communication between the gut and the brain happens from the gut to our brain. So the gut is this kind of master control center of health for your babies and your kids and us. And it's been found that antibiotics given in those very early, developmental periods, in the first 6 months of life especially, can increase the risk of virtually every single allergic disease by the time your kid is 4, like allergies, eczema, hay fever, asthma, food allergies, hives, right? And so now we understanding that, right? And this is not brand new research. This has been around for a while. We need to know, how do we mop up, use the antibiotics when they're necessary, but understand how to restore and rebalance your babies and your child and your teenagers and your gut microbiome so that they can move forward with the best health possible.
Yeah. And I guess what is in your toolkit? So when you are looking at something and you ask your pediatrician, is it absolutely necessary? Do you think we can wait a couple of weeks? So I guess one is, let's say it is viral and your pediatrician says, yeah, we can wait. And you go home with a very sickly child. What do you keep at home? And I know that this will be different from all sorts of things, but a few of the questions we got were what should be in our at-home kit? So homeopathy, supplements, all. Number one, what would that be? And then we can get into the should you need to use antibiotics, especially before 3, what would you then do afterwards?
Okay,
Sorry, break it up into 2. What's in your natural at-home kit?
Yeah. So, for my, kind of at-home kit, there's 2 parts to that. The first part is there anything at baseline we can do or give, for our child to help build up their immune resilience or immune system so that either they're less susceptible to getting sick, or when they do get sick, they can bounce back a little bit more quickly, right? Because we want a solid foundation, right? We want a foundation of like concrete, and so that, like when an earthquake comes, it doesn't topple over, right? We don't want to build our house on sand. And so that foundation, of course, starts with gut health. And so even apart from supplements, just knowing, what things can harm your baby's gut microbiome or child's gut microbiome, what things can help are really important, right? And so the most harmful things that we want to try to keep out of our kids' diet, number one, that's probably most common is, in our ultra processed world, all of these food additives, the FDA food additives, like artificial dyes and colors and emulsifiers that keep our packaged food from becoming a goopy mess, right? Those directly harm our gut microbiota and can directly cause something called leaky gut, which we can talk about later. And so when you buy packaged foods, like I have packages in my garage and in my pantry, right? This is our modern world. I'm not going to say that for some it's feasible to do 100% from scratch breakfast, lunch, and dinner and snacks, and amazing, right? For many, we live in a world of convenience, so you want to be really savvy about reading the labels and making sure you keep those gut microbiome mischief makers, I call them, out, and make healthier swaps, right? Like I was just talking with some families the other day about, okay, what if your kids love Takis, which my son, I'm like, oh my gosh, these Takis are these rolled corn, fiery chili lime rolled tortilla chips. I'm like, oh, there's artificial yellow, artificial red, there's all these preservatives. So what's the next best swap? You can buy Trader Joe's rolled tortilla chili lime chips, and even better would be the Takis, chili lime, right? So you just look at the ingredients. I've said those 3, just look and see, right? The fewer the ingredients, and the easier they are to pronounce, the ones that you understand, right? General rule of thumb, if you can't pronounce it or you have to Google what it is or what it does, don't buy that, right? Just keep it out. And then so that's probably number one, right? Just support, and then support your gut microbiome with fiber is, most of us don't get nearly enough fiber from legumes and whole fruits and vegetables. That being said, many of our kids are not right now the most kind of varied eaters just yet. So what supplements do I give to really support immune health? Number one is vitamin D. Right? Vitamin D is the most important to support immune health, brain health, and support immune resilience. And most kids and adults are vitamin D insufficient or outright deficient. Okay, so that is one of the supplements I'm the most regular and consistent about for my kids and for myself and my husband. The other supplements that I will also give, I'm talking about what I give to my kids and recommend to my patients, zinc. Most kids, at the top common nutritional deficiencies in kids are vitamin D, zinc, magnesium, and omega-3s. So guess what? Those are the ones I have to supplement with, right? Vitamin D, a little extra zinc for immune health, and also it actually improves palate and appetite for your picky eaters out there. It can do wonders. Okay? And omega-3 fish oils, right? That we are so deficient, and fish oils are so important for a healthy, balanced immune response so that you don't have too much inflammation and you also don't have not enough, right? Just enough to fight the infection and then turn it off when the infection's gone. And then probiotics. There are a couple of strains of probiotics that have been shown to reduce the frequency and duration of colds and flus in the wintertime, reduce the number of days missed from school and from work. I mean, wouldn't that be amazing, right? And so those are specific strains. And so there are some immune probiotics that can be really helpful. So that's kind of a baseline. Just, that's what we take regularly, at least over the winter.
Can I ask what those specific strains are?
Yes. And in fact, I'm going to pull up my list.
Or if you want, we can follow up and we can just, we'll put it in notes. We'll spell it out.
Because there are about 5 or 6 and they're very long and yeah.
We'll spell it out for everyone.
Okay. So you want to look for, in terms of immune health, for strain specific immune supporting probiotics, right? Because there are a gazillion probiotic supplements out there. Right? And with the trillions of bacteria in and on our bodies and in our gut, we want to make sure that we pick the strains that are actually going to do what we want them to do. And now for general health, I would pick a broad spectrum, meaning multi-strain probiotic. So that's kind of baseline. How do you get your immune system like as strong as possible? The next step is, well, what if my kid gets sick, right? What do I do? And so I use homeopathy. I teach parents acupressure points. I use essential oils. I use herbal supplements. And I don't throw the kitchen sink at kids, but for this winter time where there's so much, and we can just call it crud, right? Because it's a lot. I mean, I have kids come in and they're COVID negative. They don't have RSV. They don't have influenza, right? They don't have strep throat. So what is it? Well, there's a lot of, over 200 different viruses cause the common cold, right? There's a lot of things circulating right now. So there's some things immediately that you can do. The first thing, and I was thinking you're going to ask this, so I brought in, to show you. The first thing is, this X Clear nasal spray. Okay, this is, and I don't own any stock in these. Okay, these are just what I do. We spray our nose and irrigate. If you use a neti pot, if you have another nasal irrigation, great. But why do I do that? At the start of a cold and also after exposures, like after a plane ride or after a party where there's tons of, candy and other stuff. It takes a couple of days for those viruses to enter your nasal passages and multiply enough for you to start feeling sick, right? That's what's called the quote incubation period. And, we know that, right? We know that, there can be, sometimes after, let's say, COVID exposure, it might be like 4 days until you get sick, right? Or after the cold, it might be a day or two. So if you can flush out those germs before they really start to multiply, even better. Okay, so, this is, if there's someone sick at home, everyone should start this. Okay, the next thing is homeopathic oscillococcinum. If you go to Whole Foods, I think this is right at the register. of any pharmacy, any at CVS, Whole Foods, wherever it is. But homeopathic oscillococcinum, there are actually some randomized placebo-controlled trials with this, showing that if you take one little vial at the start of your illness 3 times in a 24-hour period. The sooner you start in your illness, the better. Kids and adults get the very same dosage. For your babies, you can put the pellets into water, a little bit of water, tap it with a spoon to dissolve the pellets, and then just either with a spoon or syringe give it to them. But the studies show that there's a significantly faster reduction and improvement in your symptoms compared with placebo, and the placebo group just continues to feel worse, right? So that is absolutely, I've had parents say that like that when they started the oscillococcinum is when they saw the turning point in their kid's illness. Okay. And then the other thing that I would have, which even pre-pandemic I was using this, but through the pandemic and especially now, there is this supplement called V-Clear. Okay, and it is the very same. So this is in a practitioner's office. At the store, it's the same as Umka, UMCKA, Umka cold care cherry syrup. And you might think, that's been around forever. Like, how is it going to help with all the crud that's going around? It is fascinating. So the studies on this herb is called Pelargonium sinuoides, which is an African bush herb, have found remarkable effects on human coronaviruses. I'm not going to say COVID because there aren't any studies on COVID, but other human coronaviruses. And I have used this during the pandemic. RSV, influenza, herpes 1 and 2, all sorts of respiratory viruses. So this, we're going to be going with Polly's traveling. This, I carry the Oslo, the X-Clear, I carry the V-Clear, and then I have other tools too, right? I have like a suitcase of supplements, but if you're just starting on this integrated route, this would be what I start immediately, right? And then one of my other favorites, because this winter there's a lot of respiratory bugs that are causing prolonged cough and just phlegm, that mucus congestion. So thyme, the herb thyme. A lot of us have dry thyme in our spice cabinet. If you cook with fresh thyme, great. And you might even have a thyme plant in your yard. And so brewing thyme tea and put a little honey if your kids are over 1. Thyme fights infections, has great broad antimicrobial properties against different viruses, bacteria, yeast, and it also clears and supports the respiratory tract. It's one of my favorites. It's kind of strong, so you want to dilute it to your kids' taste. If your kids aren't into hot tea, that's okay. You can make iced tea with it. I've mixed it. I blended it with smoothies and made popsicles. You could use grass-fed gelatin and make little thyme smoothie gummies or Jello. I did that when my son had his tonsils out, but you could do this for anytime you have a sore throat. Get throat coat tea. Make a smoothie, with different fruits and vegetables. Blend it all together, and then make Jello, and you can just sip on that Jello, goes down easily, or popsicles too.
Yeah. Okay. Thank you for that. And thank you for the visuals. And we'll collect that for everybody who's furiously taking notes as they're listening. So kind of moving into the third thing that we had to cover as a baseline, and then we'll kind of shoot into some other community questions is leaky gut. And maybe we can start with, what are the signs of leaky gut? What are the implications of leaky gut? And then what can we do?
Yeah, so that's a direct segue from our antibiotic conversation, right?
Yes.
That is one of the biggest concerns with antibiotic use if we don't mop up and restore the gut microbiome balance after antibiotics. That's a pathway into gut dysbiosis, an abnormal combination of bacteria in your gut that either don't belong or not enough of the good stuff, which can also directly pave the way for something called leaky gut or increased intestinal permeability. Now, when we think about the small intestinal lining, what we want to understand is that the small intestinal lining is 1 microscopic cell layer thick. There's 1 microscopic cell between the inside of your gut and your bloodstream. Okay, and so that 1 microscopic cell layer, it's pretty easy to damage, right? You think about the wrong foods, infections can damage that gut lining, and antibiotics can damage that gut lining. Now, what happens, just as I'm trying to think of have any visuals. I'm going to just put my hand together like this. Okay. So imagine this is two small intestinal linings. Actually, I'm going to go like this. Okay. So two small intestinal cells. Okay. These finger-like projections are called villi. That's what gives your small intestine this huge absorptive capacity. When you stretch out all those villi, it's, some say it's the length of, a football field or more, right? To absorb all of those amazing nutrients from the food you're eating. Also absorb some of the toxins and other things that you don't want necessarily, right? So this is a healthy gut. In between here, the two cells are what are called a tight junction. I mean, it is what it is, right? It says it's a tight junction between the cells that prevents undigested particles of food, bigger proteins like maybe gluten or casein, also infections from passing through. In the meantime, these villi do their thing and absorb, transport all the nutrients in. So good stuff gets in, bad stuff stays out, right? And then passes through in your poop. Now, what happens when we've taken antibiotics or have a lot of psychological stress or maybe eat too many ultra processed, high sugar, high fat foods is the junction starts to get a little bit wider. Your gut is a little more leaky, right? These tight junctions aren't as tight. And then what happens to these villi, they start to get a little bit more damaged, right? In celiac disease, which is the ultimate, autoimmune reactivity to gluten, your villi go like this, right? They get completely flat. But now your villi are a little bit, they're not as healthy. So what happens there? Your nutrients aren't absorbed as efficiently. So you don't get as many of the nutrients as you could from even the healthiest foods you're eating, okay? And then these gaps now are allowing bigger pieces of gluten or casein to get through, infections to get through, toxins to get through that normally would have been kept out. So now bad stuff gets in, not enough of the good stuff gets in, right? So you're in this state where, your immune system's like, what is going on here, right? Remember, 70% of your immune system lies in your gut, and now your gut is telling your immune system, something's going on, okay? And what can happen then? In leaky gut, what we can see is sometimes we'll get, more and more inflammation coming up, and we develop chronic inflammation. Sometimes we develop inflammation and start attacking the wrong thing. We start actually attacking our own cells, and we develop autoimmunity, right? That all can happen from leaky gut, and leaky gut is associated with virtually every single chronic childhood and adult disease, whether it's asthma or eczema. We've known about the connection between leaky gut and eczema since for almost 40 years now in the literature. And why this isn't shouted out more and taught in medical school and taught to parents, when it can make such a profound impact is I don't understand, right? It's that's why this is my passion topic, because it could do so much good for our kids and for our adults. But also think about, other chronic conditions like ADD, anxiety. We have an epidemic of mental health illness in our teens and children. One study showed that antibiotics given in toddler years could potentially increase the risk of any mental health disorder by your teenage years, right? Just getting antibiotics because of that.
Yeah, I feel like that was very much my personal story and what put me on the path. So hence you are a hero to me for really getting out there and educating parents now and all of us listening so that, your child and these children don't have to fumble through mental health stuff as a teenager and wake up in their 20s with an autoimmune condition and really have to go back and retrace all the steps.
And that's where knowing that there's something we can do, right? One, to prevent this from happening if your child needs antibiotics. And two, if you're listening and you're like, oh my gosh, like what you're doing, Amanda, this is me, like this is my child. There is something you can do from an integrative functional medicine standpoint to unravel that, right? To undo that and move forward with a healthier gut. It's just, I'm not going to lie, it's harder the older you get, right? Because patterns get set. It's like breaking these old habits, right? There's a lot more that has to be undone, but it can be. And for your kids, our kids respond so well because there's less immune, physical, psychological baggage that we carry that needs to be unraveled, right? But this is where it's not just a message of, oh my gosh, what are we doing to our kids? And there's no hope. It's, oh my gosh, what are we doing to our kids? Let's wake up and change what's going on, because we can.
Yeah. And, before we kind of get into stress and depression and the vagus nerve and parasympathetic, which I really would, your whole thought process around that, I just wanted to, and you've said it, but just to highlight again, that we've got this epidemic of autoimmunity in kids and in teenagers, and it's coming out, would you say it's coming out as eczema, asthma, ADHD, autism? Is that all, are we putting those all in the same bucket of expressions of something that could be coming from leaky gut?
Absolutely. Absolutely. And the reason is just, as we talked about, the gut is intimately connected with your immune system, and really the majority of your immune system. The gut is intimately connected to your brain via the vagus nerve, and the gut probably has more say in that connection than your brain does. In fact, what's fascinating, the gut has its own nervous system that looks like the brain's nervous system, and your gut can live without your brain, but your brain can't live without your gut. I mean, it's like we have to think, who are we and who's in charge here? Our gut microbiota, we need to think about them as the most important part of ourselves, right? That we need to nurture them just like we would our babies, right? They are, because they are taking care of us if we take care of them. But yes, when our gut is dysregulated with a leaky gut, that's why we see potentially, see problems in any autoimmune condition, right? And eczema and asthma are now considered more autoimmune reactivity, and any organ system, right? It can be the brain, it can be our thyroid, it can be our gut itself, or it can be our joints, it can be anywhere.
And just to go back to our fever reducers, do they play a role in leaky gut?
That's a great question. So ibuprofen can impact the gut lining. I mean, for people who've taken a lot of Advil or Aleve, they know it can wreck your tummy sometimes, right? Tummy aches, and potentially would cause some gastric bleeding, some stomach bleeding. So we just have to be really mindful of that and give it with some food. But there is that concern, right? That ibuprofen can sometimes irritate the gut lining and increase the risk, then compound the risk of leaky gut developing after an antibiotic course, or from an infection. And acetaminophen, I haven't seen Tylenol any direct research with the gut and leaky gut, but what Tylenol does, acetaminophen, is it depletes levels of our master antioxidant called glutathione. And glutathione is so important for detox, for fighting infections, for recovering from infections faster and feeling better. And so when we give acetaminophen, if you give acetaminophen, it's really important to understand the impact of glutathione and make sure that you're doing things that enhance your glutathione production during that time, like Epsom salt baths or sulfur-containing vegetables like your broccoli, cauliflower, and all those yummy cruciferous vegetables, and also taking either a glutathione or a NAC, an acetylcysteine supplement.
Yeah. Okay. Thank you for that. While we're hitting this list of things to get informed about and used judiciously, and I don't hear you saying ever don't use these things. It's just really gather the information, get fully informed, and then make your choice from there, and then know what you can do to recover from making that choice. So with that, we had a lot of questions around the COVID vaccine for babies. Do you have any thoughts, or even just some direction for people where they could get more information to make that choice?
I mean, oh my goodness, this is such a tough question, right? Because we know in general that kids fare much better than adults. The single biggest risk factor for serious COVID, hospitalization, death, COVID, is old age, unfortunately. I mean, that is the single biggest, even more than any comorbidity. And so our kids are the least, close to being that age, right? I creep closer and closer towards that. So, for the COVID vaccine and I did during the pandemic, have a master class just on, kids vaccine considerations for parents. Because as you just said, I'm 100% about empowering parents, helping them feel confident in whatever decision you make for your child, right? And then when you make that decision and you feel like you've done your due diligence and gotten all the information that you need to make that decision confidently, then you make that decision and you move on. You don't go back and second guess and do what ifs, right? Because that doesn't serve anybody, right? We just say, look, this is what happened. Even like with the flu vaccine, I have, one parent whose child did get very sick from the flu, and they hadn't gotten the flu shot this year, and now she's second guessing that. Another family, their kid got the flu vaccine and had a really serious reaction to it. So now they're second guessing that. We cannot do that, right? Because there's no perfect world where we're always going to know exactly what to do, but we do the best we can. And now with the COVID vaccine, there's not, to be totally honest, there's really not very good data out there showing that the COVID vaccine is doing what we want it to do, which is reduce the risk of serious disease, hospitalization, and death in children. And why is that? Because that risk is so low already that we would need many, 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 many more children in the studies to show a difference in morbidity and mortality. Okay. I mean, there are some studies looking at a couple of studies out of hospitals showing that perhaps, vaccines do reduce the risk of MISC in children. Okay. That post-COVID complication, multi-system inflammatory syndrome in children. Maybe that is a very rare complication, right? But it possibly could. Then the question is, what about long COVID? Because that's everyone's concern now, right? Because now with Omicron and its subvariants, most people aren't getting very sick. I mean, we're at the point of the pandemic. We're not anywhere like where we were back in, March, spring of 2020. Mortality rates are lower. It's a more mild illness. I have some parents saying, well, the Omicron I got in June is nothing compared to the flu I just got, right? And not to make light of COVID, right? There's still plenty of people who are getting sick and not doing well with COVID. But we're at this place now where, COVID infections tend to be milder. At least 50%, if not more, children tend to be asymptomatic, and most will have very mild disease already. So, but long COVID is what we don't want, right? We don't want to, have that risk. Thankfully, we know from the studies that long COVID in children is much less common. The criteria for what is long COVID also needs to be clearly defined, and studies vary. I know when I had Omicron back in January 2022, I was fine in a matter of days, and I used all of my natural, supplements for our whole family. And Kenzie and Bodhi, they bounced back. Kenzie, she bounces back very quickly, and she was totally fine the next day. Bodhi, maybe 2-3 days. I took maybe four days, but then we were, back fine, no problem. Yet I felt 100% fine, except I had this lingering, annoying cough and this heartburn that I had for maybe about 4 or 5 weeks, and then it resolved after about 6 weeks. In some studies, I would have been considered to have long COVID. Right. And so, but is that really the long COVID that we need to be concerned about? I would say no. We absolutely need to research and understand what to do for these people with debilitating long COVID, with the chronic fatigue and the joint pains and the brain fog and, all of those complications that are lasting for, 6+ months, right? But children to have that kind of long COVID is exceedingly rare. And we don't have any studies showing that the vaccine will protect against that for children. So, the other thing that I think about with the vaccine is, in the early days of the vaccine development, the hope was that it would stop transmission, right? That it would prevent you from spreading it, which how amazing would that be, right? We know that the what's called the R naught of COVID, of Omicron right now, meaning if you're infected, how many people could you potentially infect? It's 6 to 10. It's the highest of, except for maybe measles, right? The flu is maybe like 1.5, right? The cold is less than 1, meaning that if you have a cold, you're going to affect less than one person around you with the flu. So COVID is much more contagious. So if we could stop that transmission, I mean, we could have really ended the pandemic, I think quite a while ago. But we know now that is not what it does. It does not prevent you from spreading the infection. And it really probably doesn't prevent you from getting it, right? For adults and for elderly and those with chronic comorbid health conditions like obesity, diabetes, heart disease, yeah, it can definitely prevent you from getting seriously sick. But again, for, if the idea is, well, I'm going to get my child a shot, even though they're not at risk for being sick from it because I want to protect grandma, that's not going to be really necessarily the best way. Protecting grandma means, doing our best to stay healthy and, not seeing grandma when you do have COVID. I would test yourself if you're seeing an elderly family member or a vulnerable family member, because again, anyone can be asymptomatic. So, I mean, those are all the considerations, and there are lots of different considerations for children and adults. I do recommend. We know there are ways to support a healthy, balanced response to vaccinations, like probiotics have been shown to make the flu vaccine more effective. Right, exercise, getting sleep the night before, not stressing your body out with sugar. So if you do get the vaccine, let's make it be as effective as possible. Let's make sure that we have as few side effects as possible and do what we can to support a healthy immune response.
Yeah, thank you for that. And we had a lot of questions around just getting more informed around the routine childhood vaccination schedule. And I know that that is a really big one to unpack here. And so I would just ask, where can people do you have information around it, or can you direct us to where we can get more informed?
So what a hot button issue, right? And it's been it's interesting. I was reading, Dr. Spock is, from like decades ago. He was like one of the go-to, pediatricians, and definitely more, holistic minded, way back the 70s or, even before. And even
as a child, I wandered onto his boat and hung out with him for the afternoon.
So cool, right? So, and he's like, I mean, even back then in his book, I have Dr. Spock's, book back behind me. He talks about the controversy around vaccines and, how we just need to have a thoughtful, rational discussion. It shouldn't be, one size fits all, black or white. I mean, nothing is ever in life that way. And we never teach our kids that issues are completely, one or the other, right? That's not, a rational, conscientious mindset. And so why, when it comes to vaccines, we cannot have, this rational discussion is beyond me. It's so disappointing. And yet, as a pediatrician, I mean, unfortunately, my hands get kind of tied in talking about vaccines on a public level because, especially in California, we've seen, physicians who go against the consensus in terms of recommendations for the COVID vaccine could lose their license. Now, I'm not talking about outright, just information that is outright false. I'm talking about, for instance, a teenager may have a higher risk, a boy, of myocarditis after their booster. than from the infection itself. But the consensus is no matter what, you should get the booster. So if I tell my patient that, I could be liable because I'm going against the consensus. That is not good science, and that's not good medicine, right? But back to the conventional childhood schedule, I will say that is really one of the number one reasons why families come to me, because I'm willing to have that conversation with them, and I can walk them through, how to think about coming up with a vaccine schedule that makes sense for their child, especially as we plan for school requirements or travel, and exposure risks and risks from their family in terms of autoimmune risk and other things, and helping support them. But as far as where can they look, for more information, I still think Dr. Bob Sears' book, right? I think it's just the vaccine book, it's called, right? And then one of my, I know that there are some, naturopathic pediatricians also who have online vaccine courses that I haven't taken, so I can't really, necessarily recommend them, but I have read Dr. Sears' book. I read Aviva Romm's book on vaccines from like the 80s, which is still a great book, right? Just informing yourselves and understanding. There's no, if someone tells you that, the schedule is the only way to go, then I would say, ask, well, what if, I decide there's no one in my family with hepatitis B, my baby's not going to have sex or do IV drugs anytime soon. So what if we waited on the hepatitis B vaccine in the nursery when they're newborn and waited until, they're older, right? And maybe have more risk factors. What would be wrong with that, right? And I don't know what would be wrong with that. It's a different story if maybe you as a mom have hepatitis B and you want to make sure you don't transmit it to your baby, right? I think as we move forward in this century of modern medicine, we need to think, how do we take at every moment public health considerations and balance them out with personalized, individualized recommendations that are best suited for this child in front of you.
Yeah, thank you. And do you do consultations for families? How can people?
That is actually one of the reasons why now, I guess it's been about 6 years now, I started Healthy Kids, Happy Kids online, because it's just me. I'm a solo practitioner, and it just was getting too much to see all the patients that needed to, and see new patients, and be able to get home and have dinner with the kids. so I started the online blog information site, really as a way to get this information to practitioners and parents who really need it, and also have created some online courses. I have not yet done a vaccine course for kids. To be totally honest, I've been hesitant to do that, for a variety of reasons, but I know how much it's needed, and I do speak about that. I could not do a course on the COVID vaccine in kids, and even the adult vaccine in kids, because I just wanted parents to have information to make a solid, guilt-free decision, for themselves and for their children.
Okay, well, thank you for that. And we only have 1 minute left of your time, and so I don't know that we can get into the vagus nerve and helping children to turn on the parasympathetic and stress and depression.
Let's do that, because that also is that also is, I don't think there's anything more that I love talking about besides the gut microbiome and the vagus nerve. Well, and my kids, right? I mean, they're like up there with my kids. So important. And, for parents, if you just walk away from our conversation today, understanding that nurturing your child's gut microbiome and also nurturing your child's vagus nerve are the most important ways that you can support their overall health, then I will feel like my job was done today, that I accomplished what I aimed to. So the vagus nerve, as I mentioned, you have this two-way highway between your brain and the gut, called the vagus nerve. Most of the information is coming from your gut to your brain, 80 to 90% of it. That 10% comes from your brain to your gut. Why is that? Your gut is responsible for making up to 90% of all the neurotransmitters in your body. We call them brain chemicals, but they're nerve chemicals. They're made from our gut, like serotonin, right? If your kids have ever had trouble with anxiety or falling asleep, or managing their stress, serotonin helps us do that. And 90% of the serotonin is made by our gut microbiota. Okay, so that's why it's so important to have a healthy, happy gut microbiome. And when we talk about the vagus nerve, that also, it's so interesting. We know that the brain through the vagus nerve, psychological stress can disrupt our gut microbiome. And we also know our gut microbiome can support a healthy brain response. And so what is that link? Right? The link is then supporting a healthy vagus nerve to optimize both the gut and the brain. And the vagus nerve is part of our parasympathetic nervous system, which is our rest, digest, heal part of our nervous system. It's a part of our nervous system that gets activated when we're calm, when we're hugging our kids, when we're meditating. And that part is always in balance with what's called the sympathetic nervous system. This is our fight or flight, freeze, danger, part of our nervous system. Now, we want a good balance. We need the sympathetic, right? When we're fighting an infection, when we have a deadline due, you bet we want a little stress to, get our butt in gear, and get things going. But then we need that to go down, and we need to restore, right, and heal. In our modern world, and this is for children and adults, the go, go, go world, our sympathetic is always up. Like every day we feel like there's a saber-toothed tiger about to attack. We are living in sympathetic overdrive almost all the time. So our sympathetic nervous system gets plenty of exercise. Our vagus nerve is here, parasympathetic, like, I don't get enough exercise. So when I'm really stressed, it can't go up here and help us de-stress. We also need the vagus nerve to recover from illnesses, right? With COVID-19, there's one small study that looked at vagus nerve stimulation for patients with COVID in the ICU, and they had a much more rapid recovery. It's so needed. Like, this is not just for your mind. It's not just to feel good. It is really for your overall immune, physical, gut health. And so how do we engage our vagus nerve? We need to do it every single day. We need to practice, so our vagus nerve gets those muscles, right? And can balance out this high stress state and say, all right, I have this high stress state, but let me bring it down when I go home so I can really, really fully recover and restore. And there are simple things that we can do. Because I know, some of you are thinking, well, sure, I meditate, but can't expect my kids to meditate for half an hour, an hour. They can't even sit still at dinner time. How can they sit still and meditate, right? That's not what engaging your vagus nerve is about necessarily for kids. Okay, for kids, there's a few different ways. One thing that we can do that's really easy to teach them how to breathe with their belly, right? Diaphragmatic breathing. That has been shown to engage the vagus nerve. And how do we do that, right? Most of us breathe up here, shallow little breaths with our shoulders. So we teach them and ourselves, keep our shoulders down and relax. And when we take a slow breath in, we imagine there's a balloon in our belly. Take a slow breath in, our balloon expands. And then as we exhale, slowly that balloon deflates. Your hand on your chest, one hand on your belly, just to make sure your chest isn't moving, right? So we want to make sure that your chest stays. You can be on your back too. Watch that hand on your belly go up and down. Just doing that for a few minutes a day gets your vagus nerve practiced. You can do that throughout the day, minutes at a time, right? Another way that we can engage our vagus nerve is to practice gratitude. It sounds silly, but it's not. There's studies showing, just this simple expression of gratitude, something called a loving kindness meditation, where you just say 4 simple sentences and extend gratitude, improves vagus nerve tone, improves sense of well-being, lowers your stress hormone cortisol. And we could do this in 5 minutes, right? Those 4 sentences, first, we express gratitude to ourselves because we don't thank ourselves enough, right? And oftentimes the self-talk, the negative self-talk and the words that we say to ourselves are the meanest words that anyone can say. right? And so first, like gratitude to yourself, and you tell yourself, may I feel safe, may I feel healthy, may I feel happy, may I live with ease. And you sit there and you really bathe yourself in that gratitude. And then you think about whoever else you want to think about giving gratitude to, your kids, your partner, your friends, your family, the world, right? And we all could use more gratitude in the world. And you extend that out to them and you let them know, may you feel safe, may you feel happy, may you feel healthy, may you live with ease. And then you just sit and think and just surround them with your gratitude and love. I mean, you cannot do that without feeling just like a little bit more ease, right? And I mean, we just did that in like 2 minutes, right? And then another, I'm going to just leave with two more tools. One tool is called cognitive behavioral techniques, CBT. That's one of the best ways to improve vagus nerve tone. Therapists are trained in this, but you can get any of Dawn Huebner's books. She's one of my favorite child psychologists ever. She has these self-help books for kids, these little workbooks to teach them in a really fun way, CBT tools when they're worried or they're feeling really negative or they're feeling really grumpy, right? Or they can't fall asleep. So get those workbooks and go through them with your kids. They're tools that even you as an adult can benefit from. We all can benefit from. And then the final piece, which is sort of your entry into meditation, right, is mindfulness. And mindfulness starts with stopping, and a meditation starts with stopping and paying attention, right? That's being mindful. Right? And so this you can do also 5 minutes when you're walking your kids to school. And you know, we've all been taught stop, look, and listen, right? When we cross the street. And so that's what I call it. Some people call it the 5 senses meditation. But we stop, right? We just stop. Hey, honey, let's stop. Right? And you give yourself permission to just stop and notice what's going around you and in you, inside you. Okay. And then we look. And by looking, we look with all of our senses, but first we close our eyes because our visual input is what we use the most. And we use all of our other senses first. Okay, so you close your eyes and then you listen and you notice and you look with your ears, right? Notice, what do you hear? Do you hear the birds chirping? Did you just hear their car passing by? And then we notice what we smell. Do you smell the fresh grass? Or do you smell someone's fireplace in the chimney across the street? Then we notice what we taste. We taste the breakfast you just had, or maybe it's a minty toothbrush that you just brush your teeth with. Then we notice what we feel on our skin. Do you notice the tag on your shirt? Or do you notice your hair blowing in the wind? And then finally we open our eyes and we notice what we see. And oftentimes you will see something that you had never seen before. Right? Maybe it's a tiny little hummingbird nest. You're like, oh my gosh, it's right there in that tree, right? And then we listen, right? We listen to our bodies and our brains and how we're feeling right in that moment to solidify that experience. Right? Knowing that positive experience take a lot longer to stick than negative experiences. And so we stop and we get that memory in our brains of that positive moment, and then we move forward. That ability to stop and notice and regulate yourself is one of the most important tools for success in life. Seriously, right? And so we can do that with our kids and for ourselves. Those are all simple, easy ways to engage our vagus nerve. And then, yes, when they're older, teach them how to meditate. Take a meditation class together. Spend a half hour, an hour every day together. But I can tell you, starting with small steps, having them see how powerful it can be is the best way to get to where you might want them to be later.
Thank you for that. And that, as you said, everything you've given us today is wonderful for our children, but the way we should be caring for ourselves as well. And sometimes we learn how to best care for ourselves through really wanting to care for our children. I think that's the way a lot of people really reparent themselves and take care of themselves.
Yeah.
So I am so grateful for all of your time and all of your expertise, and I'm going to wait the appropriate amount of time and see when I can get back on your schedule, and ask all of our other community questions. So I'll wait the appropriate amount of time, and then and then I'll creep in.
Okay.
Um,
Honored to come back anytime.
Thank you. I'm so appreciative of your work. I really am, and what you do for the children and for the world. And I really thank you.
Thank you so much.
Thank you, Dr. Song. I'll come find you. Thank you. Bye.